The Minister in the Presidency for Planning, Monitoring and Evaluation, that's Maropene Ramokgopa, will be engaging with the Tembisa community today. She'll be spending the day at Oakmoor Station. That's where the Transnet Phelophepa Train is currently being stationed. This train, also known as Good, Clean and Health, is offering vital services to the community, including free optometry and dentistry care. Watching the story is our reporter Calvin Dludla, who joins us now live. And I suppose this kind of intervention, Calvin, is always most welcomed. How are people receiving it there?
Good morning to you, Ayanda Nyati, and good morning to the viewer at home. Indeed, we are here at Oakmoor Station, inside the Phelophepa train station. As you have mentioned, it offers a range of services to communities of Tembisa. I saw some of them queuing outside waiting for services. Let me introduce one of the people who works here. That would be Londega Zulu, who is an eye clinic manager. Londega, thank you very much for your time, Makeba. We are here today. When did Phelophepa train arrive here?
The Phelophepa healthcare train has been here since last week, Monday, the 12th of August. We had been in Mamelodi Station before we came here.
How long are you planning to stay here?
We were scheduled to stay here for just 2 weeks, so this is our second week here, and we will be departing tomorrow for Rustenburg.
The members of the community, what are they saying to you? Are they happy?
The members of the community that we've been able to see, they are extremely happy. Those that needed classes, they've been able to receive their classes. Those that needed referrals, they've been able to get their referrals. But, you know, we do have members of the community that is not happy. Those would be the people that we're not able to assist because, as you saw outside, there's a long queue of people that are waiting to be seen. So we cannot see everybody, unfortunately. So those are the people that are a bit unhappy, unfortunately.
Can you please explain to our viewers what is this section for? What are you doing here? I see there is a big machine here. Can you explain, as Kinana or Mabina showing the viewer at home, this kind of machine? What is happening here?
Okay, so this is our reception area. From the registration station, the patients come in here where we do preliminary testing. This machine here is an autorefractor. It gives us the approximate prescription of the patient. This machine here is the tonometer. It measures the pressure of the eye. So just like there is blood pressure, how you would measure it with the general nurses and things like that, there is also eye pressure. And if eye pressure is elevated, it could lead to sight-threatening conditions. So it's very important for us to screen for elevated eye pressure in the patients. So this is what this machine does. Right. Then from here, they then move on outside where they're going to wait to be seen by a qualified optometrist or a final year student under the supervision of the resident optometrist.
There should be some challenges that you are facing here. What are those challenges? I said there are a lot of people outside.
The challenges are immense. I think like every other project, you know, we have our own challenges, but I think the biggest challenge that we are facing is the need versus the supply. In as much as we see hundreds and hundreds of people, but there's still hundreds more of patients that could not be seen. And unfortunately, with the amount of time that we are given in each station, we cannot be able to assist everybody. I think one of the biggest challenges as well would be the fact that our communities, you know, they do not have money, they are unemployed, there's a lot of poverty going around, so people cannot afford quality eye care services. And as a result, you find them flocking in here with the hope to be assisted. So the volumes of patients that we see are one of our biggest challenges that we're facing currently.
You can tell SABC News at home, you are here, you are moving to another province. Are you able to visit rural areas?
If there is railway infrastructure, we are able to visit rural areas. The aim is to go to the most remote of places where such services are either non-existent or lacking. But sometimes we find that because of the lack of the rail infrastructure, we cannot go to the deepest of the rural areas.
To someone who resides around Tembisa, what would you say to him?
We thank the community of Tembisa for the support and the eagerness that they've shown to come and access our services. We do apologize to those ones that we are not able to see. But if they are in need of eye care services, we know that the Department of Health is working hard to make sure that most of the clinics do have eye care services. So if you could not see them, please visit our local facilities in the Department of Health.
Who are you partnering with to make sure that your job becomes a success?
As you know, this project is a CSI project of Transnet. They are the main people who are responsible for this project, but we've been fortunate this year to receive a few contributions and donations from organizations like One Sight and Eye Africa Institutes to donate stock to us. And then various stakeholders. We partner with the Department of Health, we partner with the local governments that in the areas that we visit. So it's kind of a joint operation where we get help and assistance from different stakeholders.
Thank you very much.
Thank you so much.
Well, Ayanda and the viewer at home, that was Londega Zulu, an eye clinic manager. I have to say back to you in studio because there are patients that are waiting to get services here, Ayanda.
All right, Calvin Dludla will allow them that space then. Calvin's live to us there from Tembisa. For now, thanks very much indeed.